Hey fam, let's talk nurse residency. So, if you are a nursing student, a medical student, a aspiring nursing student, you just graduated, you're looking to see what it's like, this is going to be a very positive video. It's also going to be a very honest video, and I'm going to tell you about my nurse residency without naming the residency. And I'm going to give you tips and tricks on how to be a good resident and how to be successful and how to get the most out of the program. So if that is what you're looking for, you stay tuned. So my program is supposed to be a 14-week program. It's supposed to be 7 weeks classroom and then 7 weeks preceptorship. This is specific to the ER. And I believe ICU does a similar amount of time preceptorship. And I believe MedSurg does about 4 weeks of preceptorship. They also only do like 4 or 5 weeks in the classroom. So my ER is a little different in that we do the same 7 weeks classroom, but our director extended our preceptorship from 7 weeks to 12 weeks, which look, I'm here for it. For as long as I can have a preceptor, somebody to run to with questions, I am definitely here for it. So I'm actually gonna be working nights, but I'm precepting days. I don't like it. I'm not happy about that part. I'd rather be precepting on nights where I'm gonna be, but such is life, y'all. So let's talk about the classroom first, because I don't want to get like backlogged. So the classroom part of it is like an extension of nursing school. Y'all know me. I have very low motivation to study. I'm not a person that likes to just sit there and listen to a person drone on, reading the PowerPoint word for word. I'm not going to say that all of the classroom is like that, but some of it is like it. And the instructors know it. The thing about my program that was a little disheartening while I was in the classroom is that they were in the process of transition. So there was like a lot of miscommunication in the beginning. There was a lot of like processes that had never been tried before or done before. So it just felt like we were guinea pigs, and your girl didn't like that at all. I didn't like that part at all. But what saved them was for the 7 weeks of preceptorship, towards the end, we had a simulation week, and that simulation week was amazing. It is nothing like what you did in school, where it's like punitive if you get something wrong, or like they shame you. It's nothing like that. It truly is a safe place to diagnose and do interventions and just truly learn to be a nurse and get positive feedback. Simulation turned everything around for me. I was extremely disappointed in the program until simulation week. So I'm getting off track, but okay, so 7 weeks of classroom. The first week is like an orientation week. It's like you getting used to getting to know the organization and its values and its mission, and learning about compassionate care and what it is to be a nurse, and keeping yourself from burning out and your resources. Second week, we went to the hospital. We got to be on our unit for 8 hours. We got to do a hospital orientation, general orientation, and then halfway into week 2 is when we really started the program, where it was like death by PowerPoint. Oh my God. It was just PowerPoint after PowerPoint after PowerPoint. And it was basically getting your whole nursing program into like 2 or 3 weeks. We learned, they focus on the things that really need to stand out in your mind as a new grad. So we learned about sepsis, we learned about, let's not say learned, we reviewed sepsis, MI, stroke, code blues, crisis prevention, trauma-informed care, so all of those like big topics that we gotta have an eye out for. Tons of PowerPoints. Then when you're in the emergency room, you get like it's like an ER week where you focus on skills that are relevant to the ER. You kind of go over some of those same things, sepsis and MI and stroke and all that. You go over that again. But everything is specifically focused for the ER during that week. We go to critical care week, which is actually more ICU focused, but because we hold ICU patients in the ER, they wanted to include us in that. We learned a lot of things like trach care and things that I'm like, I'm really glad I'm not an ICU nurse. We also had simulation week, which was awesome. You take turns being like the leader, being you get to be, or okay, there's like 5 roles, something like that. One is a scribe, one is the leader, one is the interventionalist. It's where you like get to put an IV in the arm and push the medications. You have like somebody who's like a safety person. Yeah, and then at the end of like your simulation, you like debrief, you like the instructor who's leading your simulation, they go over things that you could have done better, or they like if your group didn't figure out what was going on, which that never happened to us, but like, or if like you didn't figure out the medication or whatever, they'd go over, review the medication, or if you like knew what the process was, but you didn't know how to treat it, they'd go over like the treatment protocol. Simulation week, that's what it is, y'all. They also did like a skills week, and that's where we got to do practice pretty much everything you got checked off in nursing school. We did all them skills. Plus, they checked us off for ALS, BLS, and PALS, which you need for the ER. And then we had a week where we got certified for, I think it's TNCC and ENPC. It's like trauma for adults and children. What else? So that's the classroom. It was 7 weeks. Child, if I'm honest with you, there was nothing good about nursing school. There's nothing good about the classroom except for simulation week. It is what it is. You basically get paid to sit there and listen to people drone on. What can I say? Then the real work comes when you transition to being full-time on your unit. This is where you work 3 12-hour shifts with your preceptor. I just finished week 4. In a couple of days, I will start my week 5. In week 4, okay, so in week 3, I had 1 patient. In week 4, I had 2 patients. And when I start week 5, I'll be having 3 patients. Can I tell you, nothing prepares you to be an ER nurse? Nothing. I was a very proactive student. I always advocated for myself. If there was something to do, I did it. If there was nothing for me to do, I would find something to do. And I always asked, can I do that IV? Can I give that medication? Can I do the NG tube? Can I do that rectal medication? I always asked. I really got my hands dirty. Nothing prepares you to be an ER nurse. And that is the truth, point blank period, no matter how proactive you were. Nothing prepares you. And you know why it doesn't prepare you? Because you never see a patient start to finish, right? As an ER nurse, you could most of the time we don't triage our own patient, but triage, you gotta do hook them up to a monitor, you gotta put in an IV, you gotta pull the labs, you gotta draw the blood so you can pull the labs, you gotta medicate them, you have to document, sometimes you have to discharge that patient, and you gotta do that while caring for all the other patients that are there and caring for yourself, making sure you eat, making sure you drink your water, making sure you go to the bathroom, and making sure all of your patients are safe and that you're maintaining an open line of communication with the doctors that are serving your patients, with the respiratory therapists, with the charge nurse, with anybody who is there, literally, with the imaging people that are in and out. It's a lot. And as a nursing student, you don't see that process from start to finish. You never see it. And that is why you're not prepared to go and like be a fully functioning nurse straight out of nursing school, because they missed the ball, y'all. They missed the ball. They missed the ball. Anyways, it don't take very long for you to catch up, because if you were a proactive nursing student and you made sure you got your skills in and you are not afraid to like try things, you're gonna do a lot of things that you were never taught, but it's easy for you to figure it out. Like, y'all know about Purewicks, the cooter canoe? I hooked one up all by myself. Nobody taught me how to do that. Nobody showed me how to do it, but just understanding hooking up section, you just figure it out. You just know. I want to give y'all a little motivational minute here. If you are in nursing school, you just graduated, you're about to start residency, you about to get onto preceptorship, I want to tell you all, you need to hold on. There is so much good out there for you. You just have to hold on. You need to motivate yourself enough to be able to get to the point where you get to register your pointer finger on the Pyxis. You need to hold on to the point where you get to put that sticker on your paper and it is your patient, where you see your name in the computer as the nurse. You need to hold on. You cannot give up. You cannot lay down and quit, because there are patients out there that need you. I can say honestly, y'all, I have probably a 20-year job history. I have never loved what I did. I have only been doing this 4 weeks now, like on the floor, and I can tell you I love what I do. I love being a nurse, cleaning butts, medicating people, talking. I love it. Being a nurse, I love it. It doesn't matter that the pay is like subpar. I love what I do. It doesn't matter that sometimes you deal with really annoying people. I love what I do. And honestly, if you're coming into nursing and you don't know how to deal with people, choose something else. Because a lot of people come into the hospital with their preconceived notions and thinking that it's a hotel. And if you have a bad attitude, you're not gonna make it. You're not gonna make it, y'all. I can say that. That's the one thing I have noticed. The only negative comment I can make, just observing certain colleagues, a lot of them are very rude. Not to me. Who gonna be mean to me? But they're rude to the patients, and you can tell like they're kind of burnt out or whatever. But the way you speak to people feeding off that energy, and they are acting accordingly. I've approached many patients. No patient will ever say that Tamara was rude. No patient will ever be able to say Tamara didn't care. It doesn't matter how annoying they are, they're never gonna see the annoyance on my face. They may see they may see a blank stare, but they will never see the you're annoying me, you're rude. No, they'll never see that. And you have to incorporate that into your practice as well. You have to decide here and now, before you get on the floor, that you will never be that rude nurse, that you will never bring your own personal problems into the job. You got to decide from now, because when you get to the floor, people are going to start talking to you and telling you, oh, I used to be idealistic. I used to be, I'm going to be this type of nurse, and then I've just been doing this so long. You got to decide here and now that this is who I am, and this is who I'm going to be, and this is who I'm always going to be. Okay? Especially if you're young and you never had a job, it's so easy to be influenced by the people who have been there longer than you. I'm telling you, do not let them influence you into being a rude and nasty nurse. Okay? Let me influence you. Decide here and now that you are going to be the best nurse that your patient has ever had. That even if the person who is training you, or the people around you, the people you're watching and observing, even if they're not so nice, you be the bright light to that patient, the patients around you. I'm serious, y'all. Okay, I don't have anything else. Residency is what you make of it, okay? You're gonna learn as much as you put into it. So if you're lazy, your preceptor's gonna hate you and you're not gonna learn. Show up early, show up prepared, and with a good attitude. People will want to teach you if you show up early, prepared, and with a good attitude. Okay, I'm signing out. Love you.